Welcome back to Fox 51 Today. Breast cancer is one of the leading causes of death in women, but there have been some breakthroughs in treating this disease. Dr. V with Texas Oncology is here to tell us more. Now, Dr. V, what are some of these breakthroughs that you're seeing in cancer care?
You know, what we're finding out is that not every breast cancer is the same. You know, you could have a woman stage 2 breast cancer, another woman stage 2 breast cancer. There's individual things within that breast cancer that we're now identifying, the different genes, the different makeup, how fast the tumor is dividing. It's not just by the size and the number of lymph nodes. And once we find that individual things, we are able to target their breast cancer. So we call that target therapy. Now when cancer, you know, if it comes back later, we have such a different way of blocking on the cellular level of breast cancer. So the progress we're making is astonishing. I think now we're all kind of, you know, banking all the research that's been done for years and years. So I think the future is amazingly bright for our patients.
Well, that is some wonderful news.
Yeah.
So I guess, is it like many other cancers that if it's caught early, it's the better, I would assume?
Yes, and I think that's what that brings me back to the mammography and screening. You know, there are things that are so small that you can't feel. You know, so we want them on that level to be picked up. And so the only way you can pick those things up is by image, mammography or ultrasound. And now a lot of women have very dense breasts. In other words, their breasts are not bumpy, but they are very white when you see on x-rays, on a mammogram, and you can't see small lesions. So it's something they have to have an MRI, an ultrasound, and we're finding out that early detection is the key thing. You know, we would like to prevent it, and that's what we are advocating, exercise and good diet and, you know, decreasing weight. But, you know, if you want to pick it up, you want to pick it up as early as possible and before you can feel it.
Well, now we always hear about self-breast exams, and they are so important. What time would you recommend for people to start doing these?
You know, it's funny you said that, because, you know, these days, some of a young women, you know, they're in 15, 16, they already have very large breasts. So I said, once you have breasts, you're supposed to examine yourself, you know. So when you do, probably every time, every month, same time of the year around, you know, they can pick it up around before the period, you know, because things could change, and they should be consistent. And if they find something that is changing for them, because you should know your breast more than anyone else. You carry them 24 hours a day. So once you find something that's different, you should ask, you know, someone to examine you. If you're young, for mammogram, you know, so we don't want to give you radiation early on, they could get an ultrasound. So the breast exam starts when you have your breast.
Okay, well, that's good information.
Yeah. But it does not exclude, you know, you have to do both. Okay. Mammograms and breast exams.
Yes, yes, definitely.
How common is it in men? Breast cancer? 1
in 100. In women is 1 in 7, and yes, when we ask for history, we want a history from the dad's side too. Yes, so men, I don't know, men think they have pecs. You know, they don't think they have breasts, but men have breast tissue, and they get mammograms too. And if you have male with breast cancer, that definitely increases your possibility that you have that genes, BRCA1 or BRCA2, that you're passing on to the next generation. So once we hear a man with breast cancer, that definitely gets our antenna up and say, oh, there's something wrong with this family. They need to be tested genetically.
Well, now, you know, maybe we've got some more questions about this, and we'd like to hear more from you. Is there a good website that we can go to find out more information?
Yeah, I think we'll post it on the end of this. But, you know, Texas Oncology, we're a very big organization, and we have a lot of website on that thing. But we'll post that on the end, and they can do.
Yes. Well, thank you so much for stopping by, Dr. V.
Thank you for having me. It's always a pleasure. Thank you very much.
All right, well, coming up next here on Fox 51 Today, we're going to take a quick news break with our sister station. Don't go anywhere. We'll be right back.